Hello, my name is Diana Ivy Cedeno, and today I'll be talking to you about different oxygen therapy masks that we would be able to use on patients. So the first category mask I will be talking to you guys about would be the low flow devices, meaning that you're just going to get a lower flow of oxygen to the patients. So the first mask I'll be talking to you about is a nasal cannula, and the nasal cannula looks like this. And how you would apply a nasal cannula to the patient is that there are two prongs in the middle of the nasal cannula. You just want to make sure the two prongs are facing downward when putting it on your patient. So you would just insert the two prongs into the nostrils, loop the rest of the tubing around the ears, and then there is a little device that makes it tighter or looser. So you just want to make sure that the tubing is on the face comfortably for the patient and it's not going to unloop on the ears, and you just don't want to make it too tight or too loose. You just want to make it comfortable for the patient. So that's how you would apply a nasal cannula. So with a nasal cannula, the flow that you would need would be a 1/4 to 6 liters per minute for adults, and then you would need no more than 2 liters per minute for infants, giving you a 22 to 40% FiO2 range. Some advantages of using a nasal cannula would be that it is easy to apply and to use. You can use it on everyone, meaning you can use it on adults, children, and infants. Also, that it is inexpensive and it is disposable. Some disadvantages would be that it could cause dryness, which could cause bleeding in the nostrils. And what you want to do to help that is that you can add a bubble humidifier to it to help moisten the oxygen a little bit more, and that way it could help decrease the dryness in the nose. Or you can just lower the flow of the nasal cannula. And another disadvantage would be that it is uncomfortable and it could easily move around the face or get dislodged from the face. So the best use for a nasal cannula would be patients who are in a stable condition but do need a long-term therapy, and also for home care patients. And so the way for you to figure out the FiO2 percentage that you would need for every liter of flow for the nasal cannula is you just have to do a quick calculation. So the air that we are breathing in right now is 21% oxygen. And to figure out the FiO2, so for every liter that you add, you would just add 4% of FiO2 to the 21% already existing in the air. So for example, if you would want to put the patient at 1 liter per minute, you would just do 1 times 4, which equals 4, and you would just add 4 to 21%. So that would give you 25% FiO2. If you want to put the patient on 3 liters per minute, you would just do 3 times 4, which is 12, and you would just add the 12 to the 21, giving you 33% FiO2. If you want to put the patient on 6 liters per minute, you would just do 6 times 4, which is 24, and then you would add the 24 to the 21, which would give you 45% FiO2. So the second mask that I'm going to be showing you guys is the Reservoir cannula. And this is what the Reservoir cannula looks like. It looks like the same as a nasal cannula, it just has a reservoir bag in it. So with the Reservoir cannula, you would need a 1/4 to 4 liters per minute, giving you a 22 to 35% FiO2 range. And some advantages that come with the Reservoir cannula is that it is a little bit more comfortable than the regular nasal cannula, just because it does have that reservoir bag, and it is inexpensive, and it is disposable as well. Some disadvantages would be that you do have to replace it regularly, and it is a little unattractive because it does have the reservoir bag, and along with the Reservoir cannula and the regular cannula, the amount of oxygen FiO2 you are getting, or the patient is getting, could be affected by the way the patient breathes. meaning if a patient is a mouth breather, meaning that they inhale and exhale primarily through their mouth, you're not going to get as much of the pure oxygen because you are breathing in and out through your mouth instead of your nose. So the best use for the reservoir cannula would be for ambulatory patients in home care. So another mask that I'll be showing you guys is a simple mask. This is what a simple mask looks like. How you apply the simple mask is that you would just put it over your patient's face. You would wrap the strap around their head, and then there's two strings right here, so you can either tighten it or you can loosen it. And then you would just want to pinch in this metal part at the top of the nose, just so it prevents the oxygen from going up. So with a simple mask, you would want a flow of 5 to 10 liters per minute, giving you 35 to 50% FiO2. Some advantages for this simple mask is that you can use it on everyone as well, meaning you can use it on adults, infants, and children, and it is inexpensive and quick and easy to use. Some disadvantages is that it is uncomfortable. You would have to remove the mask for the patient to eat, and it could cause potential suffocation, meaning if the patient were to throw up into the mask, it would cover the hole where the oxygen would be coming out of into the patient. So that without that proper oxygen, it could cause the patient to suffocate. And then where you would use the simple mask the most would be for the mouth breathers. So how I said with the nasal cannula and the reservoir cannula, the mouth breathers who inhale and exhale through their mouth, this would be ideal for them because they can breathe through their mouth for this, and then you would use it for emergencies. So the next mask that I will be talking to you guys about will be the non-rebreather. So this is what the non-rebreather looks like, and how you would apply the non-rebreather is that you would just plug in to the oxygen, and then you would just make sure that this hole is covered so that the bag will fill up completely, and then after the bag is filled up completely, you just put it on your patient just like the simple mask over their face, and then around just put the strap around their head, and then you can tighten or loosen with these two straps, and then you would just pinch in the nose just to make sure the flow doesn't go up. So with the non-rebreather, you would want to make sure that the bag is always full and it doesn't deflate. If it does deflate, then you just want to increase the flow, because if you don't and the bag remains deflated, the patient could potentially just rebreathe back the CO2. So with the non-rebreather, the flow that you would want would be a minimum of 10 liters per minute. And then the FiO2 range that you would get would be 60 to 80% FiO2. So some advantages that you have about with using a non-rebreather is that it is quick and easy to use. It is disposable. And some disadvantages, same thing with the simple mask. It is uncomfortable. You would have to remove while the patient wants to eat. And then for the best use for this would be for emergencies and patients who need short-term therapy. So another mask that we use for the low flow devices would be the partial rebreather. So it's the same mask as a non-rebreather. The only difference is that there is a little circle which makes it a non-rebreather. You would just take this little flap off, and now you have a partial rebreather. And it's exactly the same. You would just want to hook it up to the oxygen, make sure the bag is fully inflated, put the mask onto the patient, tighten it if you need to, and pinch it in if you need to, and now you have a partial rebreather mask. So with a partial rebreather mask, the flow would be the same as a non-rebreather. You would want it to be at least 10 liters per minute, but the FiO2 range would be 40 to 70% with a partial rebreather, and some of the advantages would be the same. It's you can use it on everyone, so adults, children, and infants. It is inexpensive and it is easy to use. Some disadvantages would be the same as well. Potential suffocation, it is uncomfortable, and you would have to take it off while the patient eats. The best use for a partial rebreather would be on patients that had just been rescued from a fire who have a lot of CO2 and they need oxygen right away. So that would be perfect for that and just in emergencies. So that is all the devices that I'll be talking to you about for the low flow devices. The next category will be the high flow devices, which just means you're getting a higher flow of the oxygen. So the first mask that I would be telling you guys about is called a air entertainment mask, or it's popularly known as a Venturi mask. So this is what a Venturi mask looks like, and it's like the simple mask and the non-rebreather and partial rebreather. You just put it on the patient's face, put the strap around their head, tighten it or loosen it, pinch in the nose to make sure that the flow doesn't go up, and there you go. So with the Venturi mask, it is the flow that you would need would be anywhere from or no more than 60 liters per minute. That being said, the FiO2 range ranges from 24 to 50%, and it does have a fixed FiO2. The reason why it has a fixed FiO2 is because you would use ports, which are these things. These are called ports, and this is what gives it the fixed FiO2. So with these, to use the ports, you would just have to pick whatever flow you want. So for example, this green one, it is 8 liters per minute, and it does indicate it on the tip of the port. So it's 8 liters per minute, and it tells you that it will give off 35% of FiO2. So for another one, for my white one, it says that this is 6 liters per minute, and it would give off a 31% FiO2. So how would you use these? You would just put them at the bottom of the reservoir tube of the Venturi mask, and then you would just put the cover to make it stable and keep it into the Venturi mask, and then you would just attach the tubing to the tip of the port, and then it is ready to use. So with the fixed FiO2, some advantages of that would be that it is easy to apply, it is inexpensive, and it does give you that precise FiO2. Some disadvantages would be that it is only used for adults, so children and infants cannot use it, and it is a little bit uncomfortable and it is noisy to use. And you would want to use a Venturi mask on patients that are in an unstable condition who need the fixed FiO2. So they need the precise FiO2 in their situation. So the next mask that I will be showing you is the trach collar. So this is what the trach collar looks like. So for the trach collar, you would want the flow of 10 to 15 liters per minute input, and then you would want at least 60 liters per minute output. And that would give you a 28 to 100% FiO2 range, and the trach collar is also a fixed FiO2. So some advantages for using a trach collar would be that it does have temperature control, and it does have that extra humidification to help decrease the dryness. So some disadvantages would be that it does have a high risk for infection. It is a little bit more difficult to clean, as well as the FiO2 could vary with back pressure. And you would use a trach collar for patients who have an artificial airway. So the next mask that I will be talking to you about is called a face tent. And this is what the face tent looks like. There we go. That's what the face tent looks like. And the flow that you would need for a face tent is 12 to 15 liters per minute, giving you a 40 to 50% FiO2 range. And some of the advantages of using a face tent would be that it does give you a continuous flow, and you could use it on toddlers and small children. Some disadvantages would be that it is unstable and it could cause leaks because it is not like a regular face mask. Since it is a face tent, it could cause leaks from the top or the bottom. And what you would use the face tent, the patients you would use the face tent on would be the toddlers or small children, as well as patients who have burn injuries on their face. So a mask would be really, really uncomfortable and painful for them. You would want to use a face tent. So the last device that I'll be talking to you guys about is a blending system, or an O2 blender. And this is what a O2 blender looks like. And you would just connect it to the sides. So with an O2 blender, you would need an output of at least 60 liters per minute, and that would give you a 21 to 100% FiO2 range, which is a fixed FiO2 stability. So the advantage of using a blending system or an O2 blender would be that it does give you the full range of FiO2. A disadvantage would be that you do need a wall plug-in, so you do need a pressure of 50 psi, or psi, and you another disadvantage would be that you could have blender failure, which means that the blender could just not work. So what you would the patient that you would want to use a O2 blender or blending system would be patients who need high FiO2. So that is all the devices that I will be talking to you guys about today. Thank you.